The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Our hearts pump 42 million gallons of blood during the course of a normal lifetime. Unfortunately, for many, engaging in unhealthy lifestyle habits can prematurely cut short the work of this magnificent pumping machine. Hello, and welcome to Wonderfully Made. My name is Don Morgan, and I'm a professor in the Department of Health and Human Performance at Middle Tennessee State University. This is the 9th in a series of health programs aimed at underscoring the foundational role of physical activity in achieving and maintaining good health. In today's program, we're going to be discussing the relationship between sedentary living and heart disease, and we'll examine how a regular program of physical activity can help strengthen your heart and reduce heart disease risk. Heart disease, also known as cardiovascular disease, is the leading killer of people in the United States and other developed countries around the world. Latest estimates from the American Heart Association indicate that heart disease was the underlying or contributing cause of over 1,400,000 deaths in 2003. 1 in 3 adult men and women have some form of cardiovascular disease, and 64% of U.S. adults have one or more cardiac risk factors. From a financial perspective, the combined direct and indirect costs of heart disease in 2006 are estimated to be a staggering $403 billion. As shown in the following graphic, heart disease isn't just a single health disorder, but rather it's a general name for over 20 different heart and blood vessel diseases. Before discussing the processes which contribute to heart disease, it's important to define the terms arteriosclerosis and atherosclerosis. Arteriosclerosis, or hardening of the arteries, is a condition in which blood vessels thicken and lose their elasticity. Atherosclerosis is a pathological form of arteriosclerosis, where the inner layers of the blood vessel walls become thick and irregular because of deposits of fat, cholesterol, and other substances. As this atherosclerotic plaque grows over time, blood flow can gradually decrease, diminishing oxygen supply to the heart. The atherosclerotic plaque can also become calcified and develop cracks or ulcers, leading to blood clots that can obstruct blood vessels in the heart. When certain areas of the heart are deprived of adequate blood flow and oxygen, an uncomfortable pressure, fullness, squeezing, or pain in the center of the chest, called angina pectoris, can result. A heart attack, or myocardial infarction, occurs when part of the heart dies or is permanently damaged due to a lack of blood supply and oxygen. While the clinical manifestations of cardiovascular disease usually appear later in adulthood, mounting evidence suggests that their genesis occurs early in life. Autopsies of youth who've died in accidents have confirmed the presence of fatty streaks in the arteries of children as young as 3 years of age. In another autopsy study involving over 1,000 males and 360 females who died between the ages of 15 and 34, individual differences in the severity of atherosclerosis were linked to factors such as blood fat levels and lifestyle habits. The incidence of atherosclerosis in 10 to 15-year-olds, while only 7%, rises to 14% at 15 to 20 years of age, a relative increase of 100%. Many young people also display a number of risk factors for heart disease, such as elevated cholesterol levels and obesity. Taken together, these findings provide support for the notion that adopting and maintaining a healthy lifestyle early in life may yield significant long-term health dividends for the older adult. This next graphic displays a list of major risk factors for coronary artery disease used by the American College of Sports Medicine to classify a person's heart disease risk prior to starting an exercise program. The first risk factor on the list is family history. If you have a family history of heart attack or sudden death before the age of 55 in a father or other male first-degree relative, like a brother, or before the age of 65 in a mother or other female first-degree relative, like a sister, the risk of premature coronary heart disease is 2 to 5 times higher than persons with no family history of heart disease. The second risk factor is being a current cigarette smoker or having quit cigarette smoking within the past 6 months. The third risk factor for heart disease is hypertension or high blood pressure. Criteria for hypertension include taking blood pressure medicine, having a systolic blood pressure, which is the top number in a blood pressure reading, greater than or equal to 140 millimeters of mercury, or obtaining a diastolic blood pressure, or the lower number in a blood pressure reading, greater than or equal to 90 millimeters of mercury. The fourth positive risk factor for heart disease is dyslipidemia, or abnormal blood fat levels. The defining criteria for dyslipidemia include LDL cholesterol levels greater than 130 milligrams per deciliter, HDL cholesterol levels less than 40 milligrams per deciliter, or total cholesterol levels greater than 200 milligrams per deciliter if total cholesterol is all that's available from blood work analysis. The fifth risk factor is impaired fasting glucose, or having fasting glucose levels that are greater than or equal to 100 milligrams per deciliter. The next risk factor is obesity. While there are many ways to quantify obesity, the criteria used here by the American College of Sports Medicine are having a body mass index of greater than 30 kilograms per meter squared, or having a waist girth greater than 40 inches in men or 35 inches in women. The last positive risk factor for heart disease, and the one that we are highlighting today, is a sedentary lifestyle. Based on the 1996 Surgeon General's report on physical activity and health, it's recommended that a minimum of 30 minutes of moderate physical activity be accumulated on most days of the week. According to the American Heart Association, the chance of having a heart attack increases proportionately with the number of heart disease risk factors that a person has. Often, heart disease can be present in a person who has several risk factors whose values are only slightly abnormal. Clearly, some risk factors, like family history, age, and being male, cannot be altered. However, the remaining risk factors can be influenced by making positive lifestyle choices. For example, quitting cigarette smoking can decrease heart disease risk by 50 to 70% in a 5-year period. And becoming physically active can lower heart disease risk by 45%. Of all the heart disease risk factors that I've mentioned, physical inactivity is the most prevalent among adults in the United States. While it may seem intuitive that sedentary living increases the risk of heart disease, it has only been in the last 50 years that solid evidence has emerged to confirm this relationship. In one of the first large-scale studies in this area, published in 1953, investigators evaluated heart disease risk among bus drivers and conductors in London, England, and found that the bus drivers were at higher risk for coronary heart disease compared to the conductors, who were moving throughout the double-decker buses collecting tickets. Nearly 2 decades later, a study involving San Francisco longshoremen revealed that those whose jobs included little or no physical labor exhibited a 60% greater risk of death from coronary heart disease than longshoremen who were involved in physically demanding work. This investigation was followed a few years later by a series of studies documenting the health status and physical activity habits of Harvard College alumni. Data from these reports indicated that alumni who were more physically active demonstrated a lower risk for coronary heart disease than their less active counterparts, even when other risk factors for heart disease were controlled statistically. Interestingly, in a related study, these authors noted that former varsity athletes who became sedentary after leaving college displayed a high risk for coronary heart disease. Conversely, previously sedentary students who became more physically active after leaving college experienced the same low risk for heart disease that were found in alumni who had maintained a moderately vigorous program of exercise all along. These findings demonstrate that to secure health benefits, physical activity must be current. It can't be stored up and drawn upon at a later time. Did you know that an active lifestyle can actually lower your chance of dying from cardiovascular disease? In a study conducted at the Cooper Institute for Aerobics Research, maximal treadmill testing was used to measure the aerobic fitness levels of 10,000 men and 3,000 women. Data obtained from these tests were used to classify participants as being in poor, average, or good physical fitness. For both men and women, those classified as having poor fitness displayed the highest age-adjusted mortality from cardiovascular disease, whereas those in the good fitness category exhibited the lowest age-adjusted death rates. The most striking result from this study, however, was that the greatest reduction in cardiovascular mortality occurred between individuals who were least fit and those who displayed just average levels of physical fitness. This finding suggests that even slight improvements in fitness can yield significant health benefits. According to the lead author of this study, as little as 2 miles of brisk walking performed on a daily or near daily basis would be sufficient to attain an average level of fitness. In a later study from this research team, low aerobic fitness was identified as a strong and independent predictor of heart disease mortality, comparable to that observed for other risk factors, such as smoking, elevated blood cholesterol, and high blood pressure. Overall, the risk for heart disease among persons who are sedentary is 2 times as high compared to those who lead relatively active lives. To me, the take-home message from all of these studies is that you don't need to be a well-trained athlete or a highly fit person to be heart healthy. Just engaging in moderate levels of physical activity on a regular basis can substantially lower your risk of having and dying from heart disease. This is a message that conveys much hope and encouragement, especially for those of you that may have experienced challenges in starting and sticking with a program of daily physical activity and exercise. All of us need to look for daily opportunities to be active, like parking your car farther away from the entrance to the mall or walking into the bank to transact business instead of using the drive-through window. Instead of taking the escalator, why not use the stairs at the airport? Is it really that hard to get off the sofa to change the TV channels? Not really. The bottom line here is that all of us need to look for ways to accumulate small chunks of physical activity throughout the day, because in doing so, we can begin to reap the health benefits that come from living a physically active life. Why is it that active people have less risk for heart disease? Well, a major reason is that a physically active lifestyle helps to keep other risk factors for heart disease under better control. The prevalence of smoking among active individuals, for example, is much lower than that seen in the overall population. For people who wish to quit smoking, regular doses of physical activity can improve fitness, aid in expending calories to offset the weight gain that can accompany smoking cessation, and help to cope with negative mood states and stress. Hypertension is another coronary risk factor that affects 65 million Americans, or nearly 1 out of every 3 United States adults. Another 59 million adults have a condition called prehypertension, which is defined as having a systolic pressure of between 120 and 139 millimeters of mercury, or a diastolic pressure of between 80 and 89 millimeters of mercury. Worldwide, it's estimated that approximately 1 billion people have high blood pressure. Hypertension is associated with a number of negative health consequences. These include an increase in the workload on the heart, an increase in the size of the heart, which can lead to heart failure, and a narrowing of blood vessels in the kidneys. Hypertension can also thicken and stiffen blood vessels throughout the body and impair cognitive function later in life. For individuals with normal resting blood pressure, aerobic exercise training can reduce mean blood pressure readings by 3 to 4 millimeters of mercury. For those with hypertension, regular aerobic training can exert even more of an effect. Average diastolic and systolic blood pressures can be lowered by 6 and 7 millimeters of mercury, respectively, in persons with hypertension. This reduction is independent of changes in diet or body weight, both of which can cause even more of a drop in blood pressure. While the magnitude of these changes may appear to be small, every 1 millimeter drop in diastolic blood pressure results in a 2 to 3% decrease in heart disease risk. Again, this emphasizes the point that small changes in physical activity status can translate into meaningful improvements in health outcomes. The potential impact of participating in a consistent program of physical activity and exercise is even more apparent when one considers that individuals with high blood pressure are about 30% less fit compared to persons with normal blood pressure. A majority of studies show that the antihypertensive effect of exercise takes place during the first few weeks of increased physical activity, although further reductions in blood pressure can occur if training is maintained for more than 3 months. Based on activity guidelines established by the American College of Sports Medicine, improvements in resting blood pressure can be achieved by engaging in regular, moderate-intensity aerobic exercise, like brisk walking, performed for at least 30 minutes, Interestingly, the training component that appears to be most essential in treating resting hypertension is frequency. In other words, consistency in physical activity is absolutely vital. The role of physical activity in moderating high blood fat levels, another heart disease risk factor, depends on the type of blood fat being considered. High-density lipoprotein cholesterol, or HDL-C, takes up cholesterol from the blood and body cells, thus promoting the excretion of cholesterol from the body. Consequently, a high level of HDL-C is actually desirable and functions as a negative risk factor for heart disease. Heart disease risk can be lowered by 2 to 3% with just a 1% rise in HDL-C values. On the other hand, elevated levels of low-density lipoprotein cholesterol, or LDL-C, contribute to the development of atherosclerosis. Findings from a number of studies have revealed that endurance training increases HDL-C, but has little or no effect on LDL-C, or total cholesterol. However, if weight loss occurs as a part of an exercise training or activity program, levels of total cholesterol and LDL-C can also decrease. Moreover, losing weight can produce a rise in HDL-C, but only if the weight loss is sustained. So, if weight loss occurs following an exercise program, changes in blood fat levels will reflect the combined effects of physical activity and weight loss, along with any alterations in dietary habits which may have occurred. How much physical activity is required to produce favorable changes in blood fat profiles? In line with the Surgeon General's report, 30 minutes of aerobic exercise performed at least 3 to 5 days a week at a moderate intensity can raise HDL-C levels to health-producing values. During previous programs in this series, I've discussed how regular physical activity can help to moderate the pernicious effects of obesity and diabetes, two other risk factors for heart disease. In adults who are overweight or obese, regular physical activity and aerobic exercise improves cardiorespiratory endurance. In addition, weight loss leads to a healthier lipid profile. It has been estimated that every pound lost results in a 1 milligram per deciliter reduction in total cholesterol. A daily program of physical activity and exercise also enhances long-term diabetic control by improving insulin sensitivity and reversing insulin resistance, even before changes in body composition can be detected. For the person with diabetes, the importance of performing physical activity on a routine basis is critical, since the residual effects of a single exercise bout on insulin sensitivity and glucose control lasts for only 1 to 2 days. In addition, daily physical activity promotes weight loss, which can spur improvements in insulin sensitivity. Large muscle aerobic activities like walking, cycling, and swimming can enhance insulin sensitivity and aid in the overall management of blood glucose levels. Along with controlling other major risk factors, there are other reasons which help to explain why daily physical activity and exercise are linked to a lower heart disease risk. Coronary blood vessels in endurance-trained persons are more expandable and wider than those of unfit individuals. If atherosclerotic plaque is present, enlarged blood vessels reduce the chance of completely blocking blood supply to a specific area of the heart. In addition, there is some evidence that exercise may diminish the potential for clot formation. Taken together, these adaptations would reduce the likelihood of a heart attack. Another possibility is that regular physical activity and exercise may lower the heart's vulnerability to abnormal heart rhythms. While still an unsettled question, it has also been suggested that a trained and fit heart may develop more blood vessels, thus promoting better oxygen delivery. Before we end today, I want to spend a minute or two talking about the role that physical activity can play in preventing strokes. Stroke is a cardiovascular disease that is caused by atherosclerosis, or the buildup of plaque in the blood vessels of the brain. Stroke is the third leading cause of death in the United States. Furthermore, of those who survive a stroke, 15 to 30% suffer long-term disabilities. A variety of risk factors exist for stroke. Well-documented factors that are amenable to change include hypertension, diabetes, heart disease, and dyslipidemia. Obesity and physical inactivity have also been identified as potentially modifiable risk factors for stroke. As we know, the negative impact of these risk factors can be mitigated by adopting and maintaining a more active lifestyle. For example, in one study of over 7,700 middle-aged men, those who were moderately active displayed a 40% reduction in stroke risk compared to inactive subjects. Similarly, data collected on 72,000 nurses revealed that brisk walking was associated with a lower risk of stroke. Today, we've talked about the beneficial effects of physical activity and exercise in preventing and treating diseases of the heart. Whether you're a child, a young adult, or a senior citizen, following a moderate program of physical activity on a daily basis can strengthen your heart, reduce your risk for heart disease, and extend your life. In addition to being a magnificent pumping machine, our hearts serve as the seat of our emotions, our thoughts, and our intentions. In the Bible, Proverbs 27 verse 19 states that as a face is reflected in water, so the heart reflects the person. It is my prayer today that each of you will allow Jesus to work on your heart so that your spiritual fitness can increase in tandem with your physical health. Until next time then, keep moving step by step towards better health and fitness.